Hello, Dr. Supriya.
Hello.
Thank you for doing this.
You're most welcome.
And I would like to introduce Dr. Supriya. She is a practicing gynecologist. She runs her own hospital and she is also a parent of Adi, who is now 19 years old. And I'm so thankful that she's sharing her experience with us.
You're most welcome.
So, Dr. Supriya, the first question I wanted to ask you was, how did you get to know that something was not going right with respect to the development?
See, when Adi was 2 years old, we put him in a play group. And when, most of the times when very young children go to school for the first time, they cry. They cry and they want their mamas. And, Adi used to just walk straight with the teacher and go into the play group. And he used to not even turn back and say bye like all other kids did. That was the first time I thought that something was wrong. And he had very poor eye contact as well. Then we started seeing his social interaction with the other kids. And actually, I was not very suspicious, but my husband was, a little suspicious. And then he started reading up. And then he came across something called autism spectrum disorders, and he decided that we should see a developmental pediatrician.
Okay.
Yeah. So,
and at what age did you meet up with the developmental pediatrician?
2 years and 4 months. Okay. And we had a diagnosis of pervasive development disorder, not otherwise specified, which meant nothing to us at that moment. It took a long time for us to understand what it actually meant. Basically, he was on the spectrum. That's what it meant. Yeah.
So, how long did it take you, you and your husband and the family, to take the diagnosis and to accept it? How was it?
Acceptance is a process. It takes a long time. So initially, we were probably thinking that it's something very small and we will treat it. Being doctors, we thought that we will treat it and he will be okay, he'll be normal. That was our attitude in the beginning. So we went through what most parents go through. Initially there's a little denial that, oh, nothing's wrong actually. You don't accept things very easily. Then you feel a little angry also. You feel that why did this happen to me? Like I didn't do anything wrong. So why did this happen to me? But I think we got over those two things quite easily. Then we went to all kinds of therapists. We went to doctors, and then we started working on it slowly. We started learning about it. We started working on it. We met a lot of experts in the field, and mainly we started reading about it. And then we started realizing what all this is about.
So it's very important that you are empowered with
information. Absolutely.
Just taking for therapy is
not at all. Because the therapist is going to work with your child for an hour and maybe 2 hours. So you are going to be with your child 24/7. So if you don't understand your child, then it's not going to help the child at all. So that is needed, absolutely. So understanding the problem and understanding at what level your child is, accepting that and then working on it, setting realistic goals is more important. Not, just wanting my child to maybe, give his 10 standard exams is fine, but, he has to be capable of that initially, and we have to make him capable if that is possible.
Yes. So it took you meaning that denial and that anger, how?
It takes, when we are doing all the therapies and everything, that is one side of, a practical side of things, whereas there's an emotional side to things where you're hoping that everything, you're hoping that your child does better. So then you are also going to temples and you are going to you are taking all kinds of treatments, homeopathy and this and that and everything. And over a period of time, maybe it took us 6 to 7 years to understand that, okay, now this problem, whatever, if you call it a problem, autism is here to stay. It's not going to go away. Come what may, do what you want. Autism is not going to go away. So it's best to accept it, and it's best to teach your child to, fit in wherever possible and get other people to accept your child the way he is. So it took maybe 6 to 7 long years.
And it depends again on child to child, because every child who has autism is very different too.
Absolutely, absolutely. Whereas, there were children with Adi who were very capable. They were hyperlexic children who did well. In fact, now I know that they have given their boards and they have cleared their boards and things like that, and their moms have worked very hard to do that. So, yes, I'm sure they got the right training and they got the right help and they did that. Whereas we are still doing activities of daily living. We are still getting him to brush his own teeth. So,
But that does not mean that you didn't work. You also did your
yes,
best. And
yes.
I mean, you did whatever best that you could.
Yes, yes,
It's
absolutely.
finally more about that it's going to be different for each of us.
Absolutely.
What is for one may not be for the other.
Absolutely, absolutely.
You are a doctor yourself and you've been practicing for 27 years now.
Yeah.
So when Adi was born, you were already practicing.
Yes, very much.
So, and you got a diagnosis and you had to work with Adi.
Yes, yes.
How easy or how difficult it was to manage work
Yeah.
and being a mother?
Yeah.
Like how was it, and what is it that helps
Yeah.
to make it easy?
It is difficult. It is very difficult to manage both because you want to give your child the best and you want to work as well, because you have struggled hard to become what you become, and you want to work. So it is difficult. Here I feel, family support is necessary. Social support is necessary. Here it's very important to have um family members helping you out with the child.
Yes.
With the child, and if possible, make small sacrifices at home, at work, because it is necessary to give the child time.
Especially in the
First few years first few years where all the therapies are important, and it is important that you have to develop your child's capabilities to his or her fullest. So at that time, making small sacrifices at work and at home too, okay, is important. So I was blessed with in-laws who were very supportive so far as the child was concerned, and many times if I could not go to therapy, they would go to therapy with the child, and it helped. So yes, I mean, at times I had to forgo work, at times I had to not give up on some ambitions, but that's okay.
So Adi is now 19 years old.
Yes.
In the last 19 years, what was most difficult, understanding Adi? What was it which was most difficult that you found?
I feel initially after his birth, his early childhood was very difficult, because as a newborn, as a baby, he just never slept, and we were not aware of any problem that existed. So we used to wonder why he is not sleeping. Babies are supposed to sleep at least for 2 to 3 hours after a feed. This baby never slept. He was awake almost 24/7, and we had a tough time because I was working, and we used to try to feed him, and he used to not want to feed, and he used to be awake and crying. So the initial 1 year was very tough. Then when he was a toddler also, he had a lot of tantrums, and over a period of time, as we realized, as we got a diagnosis and we started working on him, and we taught him ways and means of communication, that at least he could tell us that he wanted water, at least he could tell us he wanted food. Then over a period of time, these tantrums went down because he could communicate.
And sleep?
Sleep also improved, though it's not completely okay even now. There almost exists a sleep disorder. So occasionally we have to give medication, we have to give him melatonin to put him to sleep. But most of the times he manages to sleep now. But yes, there are phases in which he doesn't sleep. And what was difficult was also toilet training, I feel. That he got completely toilet trained at the age of maybe 8 or 9 years. And I give a lot of credit to his schools for that, because they taught him the word toilet. So after that, now whenever we are out also, I know for certain, I have that comfort that I know if he wants to go to the toilet, he's going to say toilet or indicate in some way that he wants to go to the toilet. So I think, toilet training is very important, should be worked on right from a very young age. So these were the initial hurdles. Well, so far as schooling is concerned, we tried to put him into a regular school, but he was in a regular school for 2 years, and then the principal called us, and she said that she really didn't think that this child could cope up with the regular curriculum. So then we changed him over to a special school, and that was needed. That acceptance was needed. He was probably 4 or 5 years old when children go from junior KG to senior KG, because some amount of writing and teaching comes in senior KG, and there was no way he could keep up with the class. So then they told us that it was time to shift him to a special school, and that was very right actually.
And you were okay with it because it's so difficult sometimes for parents. Even if the child is not able to, they keep trying. And I don't think it's wrong in any way, but how did you take it?
I feel it's okay to shift to a special school because your child gets more help there. Okay, in a regular school your child does not get any special help, and if your child is capable of learning, he will be taught even there. So as you know, all special schools today have an individualized education program. There's an IEP depending upon the child's capabilities. So if your child is capable, they will teach him there too. Whereas we were, we could not even today we don't get him to write anything. It's not possible.
But I feel somewhere it is not just about the learning. Somewhere it is also about what parents feel,
it is their expectations.
Yeah, so how to deal with that?
It is better to be realistic. It is better to be realistic, accept that. And yes, try very hard if your child is capable. Undoubtedly, I feel if your child is capable, try very hard. If your child does cope up, go back to a regular school. But then keeping him in an environment where his self-esteem is going to go down because other children are going to be far ahead, how does that help? It would not help at all. So, and we had also realized by that time that it's not going to help keeping him in a regular school. So we took him out quite happily at that time. I wouldn't say happily, but willingly.
And how did you manage the sleep issues? Because it's easy to say that there are sleep issues, but then you are also having sleepless nights. Husband has. So how did you get to know that there is a sleep disorder? It was not just a part of autism. Not every child has it.
Absolutely.
So how did you?
It is very difficult. We tried everything. He used to stay awake in the day. He used to stay awake in the night. Then we met the doctors again, and they said you must try melatonin. Then we were always worried about the child getting used to a certain dose of melatonin and then not sleeping with it. So what we do even today is there are phases in which he sleeps very well. So in those phases we don't give him any medication. We don't give him medication out of fear that he will not sleep. If he has 2-3 sleepless nights, then we put him back on melatonin for a week. Then we stop again, so that his body doesn't get used to that medicine, and it works again the next time when you give it. And melatonin is a fairly safe drug. Even it is available, even in Western countries, it is available over the counter. So it's worth giving it because you also need that sleep, and you can look after your child better if you have physical rest. Yes, absolutely.
And with respect to potty training, he could say toilet, but was it easy for him to learn it? Because many parents are struggling with not the toilet training, but the potty training bit of it. They are having a tough time. Sometimes it's not on time, the same time that he could.
Yes.
So how did you kind of work that out?
Actually, initially, at least in the initial parts, initial phases, we used the principles of VBA. We used to reward him. We used to reward him every time he went to the toilet on his own, especially for potty. And since he loves water, he could use the jet spray. So he wastes a lot of water even today in the toilet, but then he manages to clean himself. So over a period of time, we withdrew the all the rewards, and it's worked. So thankfully for us, it worked, but it took a long time.
Yeah. And how much time did it take?
Till he was around 9 years of age, he was not completely toilet trained, potty trained also.
At what age did you start teaching him?
2.5 years.
So it took.
2.5 years, because potty training was a issue even then. I was working, and my in-laws were at home and they were old, and they could not go around cleaning up potty and urine all the time. It was very difficult, and you can't get your domestic helps to do that.
Exactly.
So we started working then. It took 5 to 7 years. Yes.